Okay, hi, Dr. Andy Ann with Officer David. Okay, and I just thought we would take this special opportunity to go through David's history because this is not unusual. A young guy just toughing it out and then finally getting to the point where he needs to do something. So, David, you're 47.
Correct.
Officer. Tell us a little bit about the work you do, and then we'll go talk about your knee and today's knee.
So I'm assigned to a special operations team, otherwise known as a SWAT team. Also have a dog, canine handler. Been an officer for 27 plus years. Over that time, we carry heavy weights. We have duty vests and SWAT gear and whatnot. So after doing that for 11 years, after doing SWAT work for 8 years, I developed some symptoms, which were later, we believe, determined to be attributed to wearing all this heavy gear where I lost my cartilage.
Just a lot of wear and tear.
You're correct.
Yeah. And you've been struggling with it for a while. I mean, it was affecting you professionally and physically.
Yes, sir. So September 2014 is when I first felt the symptoms. Was seen by my treating physician, which immediately ordered MRIs to both knees. And 3.5, approaching 4 years ago, I was diagnosed with severe arthritis. Structurally, the knee was fine, but I just lost my cartilage.
Yeah, and that's a lot.
Or was losing my cartilage.
Right. And that's a lot for a guy in his early to mid 40s who's so physical.
So 44 years old with severe stage 4 osteoarthritis was not a good diagnosis for me to get.
And then you started, tell us a little bit about your treatment program or the protocols you went through before we met.
So the belief was that knee replacement was absolutely the last option. We needed to buy time, which the treatment plan turned out to be getting these lubricant injections, otherwise known as Synvisc, in addition to Ketalon cortisone shots. In the beginning, so the Synvisc injections, the lubricant injections, I would get only every 6 months. And they offered me about 3.5 months of relief. And then I would struggle for 2.5 months to try and get to that next 6-month anniversary. But because my symptoms were so severe, the doctor would start giving me these cortisone shots, which would alleviate the pain. And I would say the first year, which would have been 4 total shots, 2 Synvisc, 2 cortisone, it did offer me some relief, but all it was doing was masking the pain, because going into that second year of injections, they were lasting maybe 6 weeks. And I ultimately got to a point to where we needed to finally get a referral. And that's when I was fortunate to meet this guy.
Yeah, how is it affecting work and family?
So my knee pain was debilitating. It was, I have been depressed. I have suffered from a lot of anxiety. I'm a fairly young guy, 44, 45 years old, and I had just got to a point to where I was completely disabled. I've got young kids. They play soccer. I like to be physical, hike, run with my kids, and it's been an absolute awful 3.5 months until I met this guy.
Yeah, I think we talked about it. A lot of this was, because even though you're young, a lot of us are doing it for your family as much as anybody else.
Correct.
Yeah.
Yeah, all of this was for quality of life.
Yeah.
So.
So Dave has 2 bad knees. And he had the left knee done. This one was done in November.
November 9th, 2017.
Tell us about how you made that decision to proceed, and tell us the good and the bad of recovery. It feels good now, but it was not easy, right? To either make the decision to go through recovery.
Well, again, all of the data, whether it was things that I researched, whether it was my referring physician, I was told that knee replacement is the absolute last alternative and we have to get you older. But once these injections were no longer offering any relief, I made the decision last summer to reach out to a replacement doctor, and that's when I was referred to Andrew.
You'd also try to scope too.
Pardon me. In the middle of this 3.5 years, we did do a scope to clean up some of the cartilage that was on the back of the kneecap. Again, very minimal relief. But ultimately, when I met Andrew, he told me all the benefits with very, very few To be honest with you, I don't even know what the setbacks are, what the negatives are to this. But ultimately, we moved forward. We made the decision. We did the left knee, and I was I had to be one of the most severe patients that Andrew's ever had, and to go from November 9th to January 5th, 9 weeks, I was back to work, full duty, running, exercising. And then ultimately, that was a little bit cut short. Why? Because of this guy.
The other knee went.
The other knee flared up. So here I am 2 months later, and I'm super excited. I'm in the same pain, but I'm so excited to get this done today. Fortunate to have been referred to Andrew.
Hey, before we talk about this one, tell us about the recovery. Tell us what was the tough part about the recovery. Tell us, now that you've been through this, what you're going to do for recovery on this.
So I made the mistake. So the surgery is simple. It was a general anesthesia. Didn't feel any pain when I woke up. I was fine for a couple of days. I made a very poor decision and elected not to have in-house physical therapy come to me within that first week to start therapy. I initially refused it. Don't know why I did. It was a bad decision. So initially getting the range of motion going, I will tell you, I think we started physical therapy on day 12 when it could have started on day 5. And within a few days, I was able to get all my range of motion back. So the difficulty is there is a lot of pain for about 72 hours post-surgery. Absent that, this is well worth it. It gave me all of my confidence back.
Yeah, I think you brought up a great point in terms of just being coachable, right? Because as you go through this, it's important to get help from the therapist just so they can coach you and teach you.
Right.
And you had all the enthusiasm in the world, but having a coach train you and focus your activity really makes a big difference.
Right.
In terms of
Absolutely.
therapy. Yeah.
I will tell you that we did surgery at 7:30 this morning, so it's been 12 hours, just under 12 hours. I'm sitting right now almost at what is this, a 90, Doc?
Yeah.
I'm sitting at a 90 for the last 5, 7, 10 minutes.
Yeah.
I could not have sat like this before surgery without extending my leg. Now granted, I've got anesthesia in me, but anybody that's contemplating this, anybody that has the stress, that has the anxiety, that is unable to do the physical things they want to do in their life, is absolutely crazy to delay this. If I would have met Andrew 4 years ago and he would have told me what he told me at this age, I would have did what we did, and I would have had 3 extra years of my life to be doing things that I wanted to do. So it's very emotional. Listen to this guy.
So and another really important thing you could do is, in the office we tell people, after surgery you'll be comfortable, you'll walk, you'll be safe and stable the same day, and everybody's like, nah, I'm not gonna walk.
Yeah.
It's like, no, you gotta walk. So you've been through this once before. Can you just show what kind of physical stuff you can do? Just walk around a little bit?
So we're 11 and a half hours post-surgery?
Yeah.
So, do I know that I had surgery today? Yes. Is some of this a little bit deceiving because I have some anesthesia in me? Yes.
Yeah.
But
yeah. Good. That's good. That's great.
so
Yeah. But you can see mechanically you're going to be able to do this. And this is important, not just for your head to know that you're going to be able to walk and you can move, but this is important because it keeps all the systems going, it keeps the circulation going. And so that's why we insist that you start moving the same day.
Yeah.
And then, Dave, that's your x-ray right over there.
Yeah.
So that's your new knee.
And I proudly show it to people.
Okay. Anyway, hey, thanks for sharing. I know this has been quite a journey, and we
Yeah.
still got a ways to go.
Yeah.
We're just starting to cross the second hill.
Yep.
Got a lot of work ahead of us, but this is the start of the next chapter in terms of work and just being a dad.
Well, you're not going to get me to cry on tape, so
Okay.
we're going to stop this interview now.
Okay. All right.
All right. Thanks, Doc.
Yeah.